Finished her freshman year at Franklin Marshall College in Pennsylvania. She's a Posse scholar, and she's also been involved with the program since 2005, 2006, since 2004. So she is definitely a seasoned Harlem Children's Society student. So welcome Lai Poon to the stage.
My name is Lai Poon, and the title of my project is The Expression of Melanocortin 4 Receptors in the Lateral Hypothalamus After Prenatal Betamethasone Exposure. And I work at Albert Einstein College of Medicine with Dr. Lieber Milish. Are you guys done? So here's some background information of my project. Infantile spasms is also known as the Rett syndrome. It mostly develops in infants between 3 months to 1 year of age. It consists of age-specific flexion spasms, irregular spikes in EEG, and mental retardation. This type of seizure is sensitive to adrenocorticotropic hormone treatment, which is different than the other types of seizures. And since the ACTH can be found in the hypothalamic pituitary adrenal control system, therefore we believe that due to the impairments of this axis, the ACTH becomes more effective in treating infantile spasms. In our lab, we have developed a model to enhance our study on infantile spasms. We discovered that by using prenatal corticosteroid injections, the rats become more sensitive to ACTH treatment, and by using the NMDA drug, we can induce flexion spasms in rats, which are similar to infantile spasms. So these are the two main components of our model. And here just a picture of how NMDA-induced flexion spasm looks like. Here's some information on the prenatal corticosteroid treatment. This treatment is used to accelerate lungs and other major developments in infant for possible premature delivery. And according to previous studies, it affects brain development and is associated with the impairments of the HPA stress control system. Generally, this type of treatment increases the threshold for seizures. However, it lowers the threshold for NMDA-induced seizures. And therefore, we believe that there are correlations between the prenatal corticosteroid treatment and the effectiveness of ACTH treatment in flexion spasms. Melanocortin peptides are peptides derived from the propyl melanocortin. They mediate anti-inflammatory and immunomodulatory effects through binding to the receptors. They also have the ability to control feeding behavior and mediate neuroprotective actions against brain injuries. Melanocortin 4 receptor is one of the 5 melanocortin receptor subtypes. It can be found in the cortex, thalamus, hypothalamus, brainstem, and spinal cord. While the other receptors are not found in the central nervous system, and this is the reason why we chose to focus on this receptor out of the other 4. Interestingly, this receptor also has high affinity for ACTH, which might explain the immediate actions when using the drug to treat flexion spasms. Since it is unavoidable to use prenatal corticosteroids to ensure that infants are well developed for possible premature deliveries, so it is really important to determine the mechanisms that are responsible for causing the changes in the hypothalamic pituitary adrenal axis, and to come up with new drugs to help those who are affected by infantile spasms. Because now, even though we can use ACTH to help those who are affected by infantile spasms, but many patients are still suffering from the side effects of the drug, and therefore it is really important to enhance the treatment. The focus of my project is to determine whether the expression of MC4 receptors is related to the effectiveness of ACTH treatment for infantile spasms, and whether the expression is affected by the prenatal corticosteroid treatments. Based on all the correlations, we hypothesized that the expression of MC4 receptors in rats that receive prenatal betamethasone injections will be increased compared to those that only receive saline injections. And here are the general steps of how we carry out the project. First, we would inject either 2 doses of betamethasone, which is a type of corticosteroid, or equivalent doses of saline to pregnant rats on G15 days. And then we would perform perfusion on G15 days rats. And then we would use immunohistochemistry to help stain the MC4 receptors. And lastly, by scanning the structures in the hypothalamus and counting the numbers of receptors, we can determine whether the expression for those that receive betamethasone is more than those that only receive the saline injections. We are scanning the structures in the hypothalamus because they're believed to have the ability to control infantile spasms. Right now, I'm still waiting for my results, so I would like to come up with more plannings after that. I would like to thank my mentor, Dr. Lieber and Dr. Yana, and Dr. Seth, the Harlem Children's Society, and all that stuff.